talked to community members and a lot of school teachers, and they felt that one thing that really affected their day is they were losing a lot of kids to toothaches in the schools.
Él decía que sus dientes le dolían y no quería comer nada. Tenían infecciones, lloraba todo el tiempo, no podía dormir por las noches.
Kids can't learn if they're not feeling well. There were children who had terrible teeth, rotted teeth, abscessed teeth, who had headaches and were unable to even concentrate.
Y uno no puede hacer nada, solamente decir, espérate, mijo, ya pronto se te va a pasar el dolor.
I was shocked and I was astounded that this was happening.
It seemed to be the norm in a lot of schools where there were no dental health programs and efforts for looking into taking care of the needs of the children.
Los hospitales son muy caros para ellos y a veces no nos alcanza el dinero en la casa, no nos alcanzaría el dinero para ir a una consulta de dentista.
So you have a community with a large number of uninsured patients that can't afford care, that don't have access when they're in pain and infection. They end up in urgent care and they end up in the emergency room.
Why were they having these rampant dental care issues? And what could we do about solving both access to care and then providing enough care in the right places? The solution for us was a three-pronged approach. And those three prongs were education, preventative services, and access to dental treatment. This was an entirely new concept, one that, to my knowledge, hadn't been tried anywhere.
We started the education portion through grants. We relied upon dental hygienists to come in and to be prepared to present to the classrooms.
Hygienists visit classrooms at low-income elementary schools to give presentations about healthy brushing and flossing habits. Dental professionals also conduct screenings to identify immediate dental needs. The teachers don't have to panic now if there's a child with dental care needs. There's a system in place, there's a safety net, they know what to do.
If the screening indicates that they have severe needs, they're immediately referred to the neighborhood dentist program.
Le hicieron la limpieza, les checaron sus dientes, el último tratamiento le pusieron algo para proteger sus muelas y ahorita ha mejorado bien, está tranquilo, ya no le duelen sus dientes, está muy bien.
Currently, we have somewhere close to, I'd say, 100 dentists that have stepped up in the community.
It has expanded now to be every elementary, middle, and high school has a neighborhood dentist in the city of Salem.
If the screening indicates that they have needs that are needing to be met, they can wait, they're urgent, but they're not life-threatening, then they are scheduled for the dental van. And they are scheduled in, and there's a little waiting area, and they go in, and they know why they're there, and they have their treatment right there in the van with the chairs and the equipment. Usually there are maybe 11, 12 kids served on the van, if that's a real packed day.
This is a systemic solution to this community's dental care needs for its children.
Yo pienso que con la ayuda que me están dando, a ellos han recibido un mejor educación para sus dientes, y pienso si están mejor sus dientes ahorita y reciben ese tratamiento, a un futuro ellos van a tener una buena dentadura.
We started meeting in offices and late in the day, after hours. In 1997, Jonah Edelman, Catherine Pedersen, and some other people that progressed on to small group meetings of people that were active in community events, and it was a small grassroots organization.
And from there grew over the years, grew the whole Dental Health Solutions for Children.
And people that were members of STAND took this on and went and asked their own dentists to participate in this, and it worked.
And these dentists were all of a mind to want to correct this problem.
Dentists want to do it, but they don't know how. So you need to give them the knowledge, skills, and attitudes to make it work for them. And the way we've set up this program is we try to reduce the barriers that affected their practice and their production on a daily basis.
It becomes really apparent that you can't do your job and rely on volunteers without somebody who is keeping it all together. And we were very fortunate over the years to be able to fund a dental health coordinator for Salem-Keizer Public Schools. And the coordinator position oversees the whole program. It was impossible to keep that program going without a dental health coordinator.
My advice to people that are trying to start a program is you're going to feel really overwhelmed, and you just need to take it one step at a time. And what you'll find is that the impossible is possible.
Talk with decision makers, talk with school board members, talk with city council members, talk with your mayor, talk with your local county health department. Together, determine how you can forge a plan. It may not be identical to this one, but what works in your community.
If you go ahead and just chip away and do one thing at a time and set your goal, people are going to step up and do the right thing. People want to help, people want to volunteer. It's just a matter of finding the right people. The people to work with are the can-do people that want things to happen.
My teeth used to hurt, but not anymore because I went to the dentist.
Without it, I wouldn't be able to have a full deck of teeth and look pretty with my smile.
And now I can sleep good at night and pay attention in class.
My favorite thing in the whole wide world in general dentistry is when the Head Start bus would pull up with 3- and 4-year-olds that came into our office, and nothing's more rewarding than taking an anxious child and keeping them comfortable, or better yet, making them want to come back to the dentist.
What has moved me the most is that all persons from every walk who needed to be part of making this program work stepped up to the plate. And there was just this overwhelming sense of community and of care for the children and fixing something that was fixable. That continues to be my greatest inspiration to continue.